everyone, and greetings from Prana. Prana is a unique center which specializes in integrating ancient and complementary sciences like homeopathy, yoga, acupuncture, osteopathy, chiropractic and counseling in offering treatment plans to our patients. Our team consists of eminent practitioners and therapists, and one of them is Dr. Shrikant Talari, who practices cancer care. Dr. Talari is an experienced homeopath, an author, a teacher and a researcher, and has been providing his expertise to hundreds of cancer patients worldwide. Welcome Dr. Shrikant Talari, and we would like to begin with asking you a question as to how does homeopathy help in cancer?
Yeah, thank you madam. So how homeopathy helps in cancer? Basically we need to understand that there is a difference in approach. When you come to a homeopath or when you go to allopath, there is a complete difference in how we are going to treat you. Because the allopathic approach is that to see that there is a cancer cell in a particular patient and they want to somehow get rid of that cancer cell. So either they will do a surgery and get the cell out, or they will give chemotherapy and kill the cell, or radiation and kill the cell. This is the allopathic approach basically. The homeopathic approach is to look behind and to see why did this cancer cell come in this person. Because if we look at it, we will see that we say that cancer happens to people who smoke, for example, or people who eat tobacco, or people who don't have a good lifestyle, or because of the pollution or the pesticides that we are exposed to today. So these are all the various causes that we say are for cancer today. But actually if you see, you might also have seen there are many patients who will smoke, who are chain smokers, but who have never developed cancer. But there are people who will tell you that I live the best of lifestyles. Why did I develop cancer? I know my friend, he does all that. Why he did not? He is doing much better than me. No? So the answer here is that, or what we call in homeopathy known as susceptibility. If you are susceptible to a particular illness, then even if with minor exposures, you will develop it. If you are not susceptible to it, even if you are smoking every day, you are not developing it. So that's the main approach of homeopathy, to find why did this patient develop cancer, how did he develop cancer, what is the reason behind it. So we are treating the reason and not the end product. So if you treat the reason behind the cancer, then the cancer production stops. All the allopathic treatment is all about only getting rid of the cell. So you will see many patients coming, they'll say, I took treatment, the cancer has come back in 1 year. I took treatment, they say that I have certain illness which they say after few years it may turn cancerous. Can you do something? There you don't have option. Here we have options. We can treat predisposing conditions of cancer. We can treat cancer. We can also prevent cancer. So that's what we can do with homeopathy.
So do you use or can we rather use homeopathy for all these various types of cancers in their various stages?
Yes, all stages, all types of cancers, homeopathy is useful.
And the most common question when it comes to homeopathy is, will I get a quick relief?
Yes, definitely you will get quick relief with homeopathic medicines. See, again, I will tell you, the answer here, is coming back to this susceptibility. So what we have to understand is that if I have developed cancer, it is because of some reason. Oh, maybe my lifestyle was not good, maybe because I had some mental emotional stress, whatever reason. Okay, so if I give you a remedy, suppose your main symptom, not you, any patient's main symptom is pain, because people don't like the themselves associating with this diagnosis. That's why I said not you. Huh? So, suppose pain is the main presenting symptom. The concern is, such intense pain, I have taken morphine, I have taken this, it's not getting better. Okay? So now will homeopathy do something? Will I get, after taking so much it's not better, now can your medicine do it? I can tell you I've seen results in hours. Means if you are able to find the right remedy, then the symptom gets better within hours, sometimes even minutes. But it all depends on what I say is susceptibility. If your overall lifestyle was just disturbed for few years and then you develop, then you will get much more quicker, faster relief and you will come out of it. But there is a very, very bad history, long history. So you will get relief. I am not saying you will not get quick relief. Even in such cases you will get, but it will be partial relief. So if for a patient who has very decent lifestyle and he has pain, I give remedy, within hours his pain is gone and it's gone for a very long time. But patient not very good lifestyle, for a long period of time and he has very advanced stages, there will be definitely relief, but it may be 50%.
Yes.
50% still is there. So it varies on patient to patient basis. What is the reason behind, what is the stage of cancer, what is the type of cancer? Based on that there will be relief and there will be alleviation of symptoms. So on a broad level I say definitely yes, we can relieve quickly.
Okay. And it is very common that patients, especially after a diagnosis of cancer, start with chemotherapy or radiation or something of this kind of treatment. So does homeopathy interfere with all this? Does it complement? And do we use homeopathy with all this also?
See, if you ask me ideally, I have seen many patients. I am practicing since 10 years on cancer exclusively actually. If you ask me in which cases did you find the best results, those were cases which took homeopathy exclusively.
Wow.
They did not take any other therapy. So a typical patient who comes to homeopathy is one who has tried everything. I have already done surgery, I have already taken chemotherapy, I have already taken radiation, but cancer has come back or nothing is helping, I am already taking morphine, nothing is helping, now can you come? These are the most common patients who come to us. Very rarely a patient says, I have diagnosis today and they come to a homeopath. It never happens actually. Patients come to us after they have tried everything. Okay, so we suggest such patients that you better now stick to us only. As it is, you have tried everything, you take this, you will have very good results. People who have trusted us, who have believed in us and whom we are able to find the right remedy. So this is one very important aspect in homeopathy, whether you are able to find the right remedy.
Correct.
If you are able to find the right remedy, then whatever the stage, whatever the type of cancer, you will be helped. Helped is also another important word. I am not saying cured. You will be helped. Definitely you will get relief. Definitely you will have a better life, better quality of life, better quantity of life. So that's what is the thing, that whatever stage, whatever type of cancer, if you take exclusive homeopathy, you will have much better results. I have patients of their relatives being MD physicians and all them, doctors basically in their family, they say that, my relative, they are very old, I don't even see the sense of giving them some chemotherapy, etc. So homeopathy has no side effects. Either you will help her or you will not help her. You will not cause more problem. So that's why they refer. You do something. As it is, I have done everything what I have. Now you do something. So people with lung cancer, stage 4, with life expectancy of only 6 months, they have lived for 4 years with homeopathy. What is most interesting is, this old patient that I remember, she was around 65, 70-year-old female. She had lung cancer, her whole lung was involved, metastasis in the mediastinum, liver, everywhere. She was given life expectancy of 6 months. She took exclusive homeopathic treatment. She lived for four years. But what is interesting is in the last 1 year, she was also climbing stairs. For a lung cancer patient, to climb stairs is impossible because the moment they start walking only, they feel breathless. For them to climb stairs, they were they said, maybe, we misdiagnosed our relative. Let us re-diagnose her.
Yeah.
How did she live for 4 years? How is she walking like this? So they actually re-investigated her, and then they found, no, she still has cancer, but she's walking, she's doing all this. And they were really amazed with the homeopathic treatment.
Wow.
So if you want such amazing treatment, then go exclusive. But majority patient, they like to do khichdi. They like to take homeopathy also, allopathy also, if possible Ayurveda also. Whatever they think then that take everything, kuch na kuch kaam karega. Something will work. This mindset is not good. I am telling you this from experience. Patients who are taking everything, they have minimum results. So I give them medicine, they say I am better for 2 days. Wow, but I took this also, now I am not better, now you again give. So those patients I need to take follow-up every 3-4 days, 4 days, 5 days. They are having relapse of symptoms. Their quality of life is not so great as compared to those who are taking exclusive.
Wow.
So my suggestion is go exclusive. If you want to take all, you can take. It's not a contradiction that if you take this it will harm you or something. It will not harm you, but it will reduce your amount of relief. You will have relief, but it will be lesser as compared to exclusive patients.
Okay. So now we also have some very common questions which our audiences want me to ask you. First is, how are you able to help a bedridden patient with cancer?
So as I already told you, so majority patients that we get are bedridden patients because they have tried everything, only then they come to us. Okay, the second common are those who have taken everything and want prevention. But the majority are these only, bedridden patients. Come, please see us in the hospital. Come, please see the patient at our home. So these are the majority patients that I see day in, day out. So yes, definitely we can help such patients and we can improve their quality and quantity of life. I already gave an example.
Yes. The second question is, if I take homeopathy, will I get cured of cancer?
Depends on the type of cancer patient has, and the stage of cancer, age of patient, the lifestyle that they have lived. All these factors have to be accounted for. So there is no one standard answer. Does homeopathy cure cancer? My answer is yes and no. It depends on the patient.
Yes.
Patient decides whether he is curable, whether he is preventive, whether he is palliative. Patient decides. Homeopathy offers all.
Okay. And so there are so many times when patients come up with the apprehension that someone very close in my family has had cancer, had a history of cancer. Will I get one? What should I do?
To prevent.
So how do you address such questions?
So these are the second most common patients that come to us, that I already have taken all this, now can you do something to prevent? So as we already answered, no, because we are treating the cause behind the cancer, because we address the cause, it will make sure that you don't have cancer and it will prevent cancer.
Okay.
Most important thing here is, because very interestingly what you asked is, someone in my family had. It's not some lifestyle that I lived. So I smoked, so I developed cancer. This is different. But someone in my family had it. Now I can't do anything. So this is a genetic predisposition. Most importantly, in homeopathy, we have medicines which can act on genetic level and which can prevent this genetic predisposition. So we can treat the genetic predisposition also, which is going to lead to cancer.
Okay.
Because as we said in the beginning, this genetic predisposition is the susceptibility. There is a sort of tendency that you can develop. Now if you complement it with some lifestyle, some smoking, some like if you add oil to this fire, that is already, now you will develop.
Right.
But the fire itself is in the predisposition.
Okay.
If we treat the predisposition, there is no
Wow. Okay.
chance that you develop the cancer.
Okay. And coming back to the integrated approach that has been offered at Prana for cancer care, can you enlighten us on how, along with homeopathy, how does yoga help in the treatment of cancer?
Yes. So, to answer this question, first, now let us understand what are the causes of cancer. Because we said we treat the causes, So what are the causes? Basically, on a broad spectrum, there are three categories of causes. First is genetic predisposition that we discussed. Second is physical causes like, smoking, like bad diet, like exposure to pollution, like pesticides in food, like water having heavy metals, so many of these, or diseases like inflammatory bowel disease. There are certain diseases which predispose you. So these are the second category, which we call as the physical or lifestyle causes. The third category is mental causes. So like after grief, so interestingly, this lung cancer patient that I told, she developed cancer immediately after her daughter-in-law died out from cancer, leaving behind two small children. She could not take that grief of how these small children are left behind. I have to take care of them. Just that sadness, she could not get over it, and she developed cancer. So these are the broad categories: genetic predisposition, physical causes, and emotional causes. So genetic predisposition, as I told, homeopathic medicines will take care of. Physical causes need lifestyle changes. So you have to stop smoking, you have to eat healthy, you have to breathe healthy, you have to sleep well, you have to stop all these exposures. That is where all our integration approach basically comes in, where we are suggesting patients that you take this dietary approach, or you take this yoga pose, so that you are able to breathe better. So for example, if a patient has, somehow we are getting back to lung cancers only today. Suppose if a patient has a lung predisposition disease, so for example, patient has an interstitial lung disease. So what we will do, with yoga, we are able to align the body, expand the body, give more, increase the lung capacity by making the patient do various poses, yoga poses. We increase this capacity, and that increase in capacity will definitely increase your function of your lungs, and a healthy lung will not develop a cancer cell.
Yes.
So that's how yoga is basically used to align and to make sure that the energy channels in your body are flowing properly. So I remember another cause of cancer that is given today is that a cancer cell develops only in an anaerobic environment, if there is no oxygen in an environment. Actually, Dr. Otto Warburg, he got a Nobel Prize for this discovery, that the cause of cancer is an anaerobic environment. So what yoga does is, it makes sure that oxygen reaches every single cell of your body. Right? It's not just the lung. It will ensure that every single cell of your body is getting this oxygen, so that you are not going to develop cancer. And if you have developed cancer, that there is enough oxygen that the cell starts to understand that because I have enough oxygen now, I no longer need to function like a cancer cell. This education of the cell itself stops the cancer cell production.
Okay. And what is the role of osteopathy and chiropractic in the treatment of cancer?
So osteopathy, chiropractic, these are also somewhere similar to yoga, because they also basically align. They align the spine, they align the muscle, etc. So they are also working on energy platform. And that's why we are named Prana, because we work on energy level. Everything that we do is make sure that the energy of the patient is good. So it's very similar to yoga, but the difference is in yoga we are making you do it. You yourself do it. Obviously, because we are inspired by Guruji BK's Iyengar, patients don't have to go through the rigorous asana. No, for a cancer patient, you don't expect that he will do a bhujangasana or a chakrasana. He will not be able to.
Okay.
But with the use of props that Guruji has invented and discovered, it makes sure that with minimum effort also the patient is getting maximum benefit. So like that, in yoga what is happening is, even with the help of prop, you are only doing it, okay? But in osteopathy or in chiropractor, our therapist is doing it. He is aligning it for you. You have to just come here, sleep, he will do all your alignment, सब पुर्जे आपके सीधे हो जाएंगे और फिर then you can go home. So it's a more passive therapy. Sometimes you feel patients are not able to do anything. They will not be able to do, in spite of the best of props that we have, they will not be able to do. So for them, we may suggest that you go for
Acupuncture.
For osteopathy or chiropractic.
Yes. And what do you think, how does acupuncture help in the treatment of cancer?
So here again, you know, the common link is energy. Acupuncture also works on energy level. So what we do through acupuncture is we stimulate the energies over here. So in yoga, in chiropractor, we were aligning the body so that the energy flows. There's no blockages anywhere. So through acupuncture, you're stimulating. You're actually, there's no block, but due to some reason, that channel has, you know, dulled. It's lost its vitality. So you prick those needles or press, so that on certain particular points, on particular areas, based on what diagnosis, what type of cancer the patient has, you stimulate the energy channels, so that again as we said, the energy, the oxygen, all that is again, you know, flowing well, so that the cell receives enough of oxygen, nutrient and all that support, so that it comes back to being normal rather than being a cancer cell.
Okay. So with all this information that you have shared about different complementing sciences, I'm curious to know, how do you actually select the treatment plan for the patient?
So the treatment plan is, as I've been already indicating, no, it's based on the patient. Everything that we do is, you know, tailor-made. Patient decides everything for us. We don't have standard protocols. You know, like suppose a mouth patient comes with breast cancer, okay? So we will look and search first what is the cause. What is the cause of her cancer? If it is emotional, then we will give a homeopathic remedy. This is very interesting. Homeopathic remedy has the capability of making the patient recover out of their grief, recover out of their anger. You know, patients often come and ask us in Marathi, they say, "Swabhavala aushad asta ka?" Can you change a person's mindset? Yes, with homeopathy we can change, not like like a very angry person, we don't make you into a sadhu or something like that, but from extreme anger we bring back you to middle of anger. No, I am able to control my anger, I am not as angry as before. This kind of changes we can actually do with homeopathic remedy. I have patient testimonials. I like to show it today. We don't have the space over here, but you'll see our patients talking that I was sad, now I don't feel sad. I was angry, now I don't feel angry. I was whatever the emotion, that emotion has come down. So we will treat your mind, your body, okay? Suppose we see that in your body the problem is that your spine somewhere is stuck, then I will say, okay, now you need our chiropractor, he will align you. But your spine is okay, I will not send you to a chiropractor. Why? You don't need it, basically. So patient decides that if they have a spine problem, we will refer to a chiropractor. If they have an energy stimulant, that we see that, you know, in a particular area of their body the nerve stimuli is not there, the energy is not flowing there, that area looks very dead, then we will say, okay, do some acupuncture sessions so that the area starts getting stimulated. And then we will complement it with yoga to make sure that the whatever stimulation they have received through either chiropractor or through acupuncture is sustained or maintained with the yoga therapy. And homeopathy is basically treating the genetic predisposition, the mental cause, the detoxification. Because in physical causes, what we saw that there are so many things, smoking, all this is already in. Something has to be done to get it out, no? So the homeopathic remedy will detoxify. It will detoxify the mind and the body. Whatever unwanted emotion you are carrying, it will detoxify. Whatever unwanted chemicals you are carrying, it will detoxify. Whatever predisposition, genetic predisposition you are carrying, it will take care. And then we are complementing it all with diet, with yoga, with acupuncture, with chiropractor, all this. So you see, it's a very, very holistic approach. We are taking care of every single cause of cancer from all areas.
Yes.
To ensure that the patient is better from all angles. That's why we believe in holistic improvement. This is what is holistic improvement. The patient improves not just with the pain. So you asked a question, will you give me pain relief? That to we will give, but we are giving much more than that.
That's right.
We are giving you prevention. We are giving you this whole holistic approach to get rid of this tendency of cancer. No? Who treats tendency of cancer? Nobody even imagines talking about it. We are the ones who are talking about, we will get rid of your genetic tendency to have cancer.
And most importantly, the quality of life too. The quality along with the quantity.
Yes, and all this is without side effects.
Yes.
There is no side effect, there is no bad effect. You are only going to improve every day. And if just to talk a negative, by chance if it does not work, it does not work. It does not harm.
Yes.
No?
Yes.
So because this is very common in cancer patients. We see patients that I had no symptom, I was okay, some accidental finding I had, I started treatment, now I am having symptoms, now I am suffering.
Right.
So this therapy will only benefit and only benefit.
So we know, Dr. Shrikant, you have been treating a lot of patients worldwide who have been suffering from cancer. Can you share some of your patient stories with us?
Yes. Now you used worldwide, so worldwide. So one very interesting thing is now we are treating a lot of online patients. So you asked whether we treat bedridden patients. One of the ways is treating online.
Yes.
So we are meeting patients all over the world now. That's why we are able to see worldwide because of online Zoom and all these facilities. So one such case that I remember, and especially because we talked about integration, no? So let's take this case example. So this is a male patient around 70 years old. He had not 70, maybe 60 years old. He had cancer of the cecum, which is the large intestine of in our body, part of large intestine. So he had cancer, and along with that he also had diabetes, he also had hepatitis B, he had hypertension, he had already undergone heart surgery, bypass surgery, so many things he had. So the cancer was found, he underwent surgery, he did chemotherapy, he did radiation. He thought, okay, now I am over it, but after 2 years the cancer came back. Now what is interesting here is his blood sugar level was not under control. It was very high. So generally if you have very high blood sugar level, then you can't do a PET scan, which is a scan to know how much the cancer has spread. So in this case they were not able to do this test. And without this test, they can't even give chemotherapy or radiation, because radiation, so they need exact location. Without exact location, they can't. Chemotherapy also, which chemotherapy to give, how much to give will be defined by the amount of spread. Now they don't know what is the spread. So already he had widespread disease 2 years back already. So now what happens is that this patient comes to us and he says that, can you help me, because they have treatment but they are not able to help me, they can't treat me. So then we took the case, we found a remedy, we gave a remedy, and this patient did very well on homeopathic remedy. So 2 years passed. After 2 years his PET scan was done. After around 1 year they did PET scan, and then they saw that how come his cancer seems stable. After 1 year the cancer is stable, it has not spread, it's not widespread. Then his hepatitis, he had hepatitis B, that test came negative, it was positive. Very rare, it does not happen. If you tell some allopath, they'll say, how is this possible? But this happens. In homeopathy it happens. Then his blood sugar level came under control. He was already taking insulin. He continues to take insulin, but in spite of that it was not under control. With homeopathy it came under control. So he was very happy. I have no symptoms. My sugar is under control. My hepatitis, I didn't ask for hepatitis. Hepatitis also got better. My heart also seems okay. I am able to walk around, talk around. Everything is good. So he got much more than what he expected. He didn't come for sugar or diabetes or hepatitis. All that is the add-on benefits that you get even if you don't ask.
Right.
Okay, you will get it. You will get holistic treatment only. Whether you have 1 disease, 2 disease, 3 disease. We are the most economical people because we treat all these diseases with our one medicine and one treatment plan. One treatment plan for all disease. If you go anywhere else, they will give for this disease this treatment, for this disease this treatment, for this disease this treatment. So we are, in my opinion, we are very, very economical also if you are treating all these diseases with just one treatment plan. So coming back to this patient, now what is happening is that he has cecum cancer, large intestine. So in this cancers, what is important is that the most important symptom is constipation. These patients typically have constipation for years, and if that constipation is not cured, then there is a tendency that it will come back. And we said that we treat what? Tendency. The tendency only has to stop. The core symptom which is going to sort of ensure that the cancer comes back, that core symptom has to go. Even though in this case this patient is happy. He feels I am doing well. But I as a homeopath, because I have the knowledge, I am not happy. I am concerned that till this constipation does not go, he will get it.
Yes.
So I am very concerned. So I try different remedies, I keep changing, etc., etc. It doesn't work. 3 months pass, 4 months pass. So I say, remedy is okay. He's doing, he was a regular exerciser. He used to play badminton regularly. He very conscious about diet, does not eat sugar, very less oily. So lifestyle also very good.
Fine, yeah.
So I see, yeah, lifestyle is good. Symptomatically patient is better, but this symptom is not going. What to do? So he said that, I have heard that you should take wheatgrass. Wheatgrass has high fiber, so then my bowels will sort of start to get empty, and my constipation will be solved. So initially I thought, as it is, my thing is not working, you take wheatgrass. So he took wheatgrass. He came back after a month. He said, no relief. Wheatgrass I took, high fiber, not helping. So then I said, something must be helping. No, what helps you? So he said, actually I will tell you one thing, doctor. This month I had little bit better stools. But I am concerned that what I did is not good for my health. I said, what you did? So he said, this wheatgrass thing first I took for 15-20 days. It did not help. So I said, leave it. I started eating ghee.
Okay.
Ghee is, what is the English name for ghee? I don't know. So,
Clarified butter.
clarified butter. So he took that. He said, whenever I take that, no. So suppose it's 5-10 days I have not had proper stool. So one day I'll put that, I'll take it. But I have stopped all that because I am concerned my heart is a problem. My cholesterol will rise, my sugar will rise. So I don't do all of that. Once in a while, I will put it and I will start taking it. And it is, since I had this heart surgery, I have stopped that. And since then I am having constipation.
Oh.
So I said, forget heart, okay? You start eating ghee. Heart I will take care of.
Correct.
With the homeopathic medicine. Even if you eat butter or ghee, your cholesterol will be under control. Your heart will still function properly. And you start eating ghee properly. Every day you eat. This is not at all a sin. You can eat and you can live healthily without any cholesterol. That we will take care. Till now he is my patient. He's my patient since 2016. Now we are 2024. He still has no relapse of cancer. I think I saw him 2 days back also. He's still doing well.
8 years.
8 years, no relapse. And you ask anybody with uncontrolled diabetes, with so many comorbidities, we discussed, comorbidities is one very big thing.
Absolutely.
The background. One background we said was lifestyle. Actually, another background is comorbidities. If you have so many illnesses, then the chances of your recovery become less and less and less. So in spite of so many illnesses, he continues to be better even after 8 years. And why I narrated this case is obviously the result, but the important aspect is this ghee. Patients feel that I should not eat butter, I have cholesterol, I should not eat this, or I should try wheatgrass. These are all information that is available outside. If I eat high fiber, I will good stools, so let me eat high fiber. So there are hundreds of things like this. Some will say you take this vitamin, you'll feel better, you take this, you'll feel better. But the whole game actually is individualization.
Correct.
This is the main principle on which we work. So if you are belonging to a particular community, you have a particular diet on which you have grown.
Yes.
So you should stick to that. That suits you.
Yes.
You should not suddenly change and say, now I will become healthy. No, for 40 years you have been healthy with that diet. Why are you changing it? So don't change.
And your generations have been healthy with that diet.
Generations are healthy. Please don't change. These new things, they come, they will go away. Okay, these new things will come and go away, but what you have been used to, you should eat. Okay, now this patient has been used to eating this ghee, butter, etc. since his childhood. That used to keep him healthy. So this patient should continue to eat that, rather than trying anything else or any new fad, any new video or any new article that they have read. So this is very important, that you have to choose your diet also based on your individual need and your individual susceptibility. Even diet. Okay, we said osteopathy, chiropractor, all that, so we will do individualized.
Yes.
But we are saying even your diet has to be individualized. It can't be random. All cancer patients tomorrow start eating this. No, please don't do it.
Right.
You may in fact harm yourself. This patient has harmed himself by taking such generic opinions, that you have this, you stop this. So please don't take generic opinions. All these articles, YouTube videos that you see today, they are based on certain 1 or 2 case examples. We cannot generalize them. We cannot make them into standard protocols. From today all cancer patients start doing this. No, it will harm you. So please understand, you have to meet an expert. You have to allow the expert to decide what he or she needs. I have heard this, let me take this. I know that patient was benefited. It does not mean it will benefit
work like
you.
that.
And not only benefit, it can harm you. People feel it's a natural thing, what will happen? No. If you are changing it drastically, even if it is natural, it can harm you. So please, we should always seek a expert opinion based on our individual susceptibility, so that we get this holistic relief.
Yes.
So holistic approach and individualization, that is what we do over here.
Okay.
And that is what works for every single patient, because it is tailor-made, made only for you.
So thank you Dr. Shrikant for sharing such valuable information with us. If you have any more queries, any more information that you want to be addressed with Dr. Shrikant, our numbers are displayed below. Our email is displayed below. You can feel free to write to us. We'll get back to you soon with such more informative sessions. Up till then, see you, take care, have a good health. Thank you.
Bye-bye.